And Philadelphia Health Commissioner Tom Farley, he admits that meeting the state's guidelines to reopen the economy is going to be very difficult in Philadelphia. Here's what the math looks like in Philadelphia. According to the state guidelines, the city would have to average just about 56 new cases a day to consider reopening and going to the next phase of economic recovery. That would be over a 14-day stretch. March 26th was the last time Philadelphia reported fewer than 56 new cases of coronavirus. We're still hovering around 400 cases per day. How long is it going to take you to get to 50 or less?
Well, that's a good question, the question everybody's asking. And it really depends on how effectively people do the social distancing recommendations and what the virus does. Right now, it appears that our case counts every day are going down on average. You see fluctuations here and there, but on average, we're in a downward trend. People can plot that out, but I don't know whether we're going to go down at the same rate over the next few weeks, or accelerate in our decline, or plateau and reverse. It really depends on that future.
Have you done any modeling to project how long it might take?
I've done some just quick estimates of, you can look at it. If we go down the current rate, we might be, there in late May, early mid-June, but I wouldn't want anybody to say that that's a prediction, because there's just so much that's an unknown right now.
One thing that is known is how low Philadelphia's new COVID-19 case numbers need to be. The state's requirements for moving to a new reopening phase means over a 14-day stretch, a city with more than 1.5 million people couldn't have more than 780 new coronavirus cases. Do you think that the state's expectation is reasonable for a city the size and with the density of Philadelphia?
I think it is important to have some pretty clear criteria in place where we're confident that we are going down, so that there's no sign that the virus is really picking up speed again, and that we have a low enough number of cases so that if people do slip up, we won't rise very quickly. And so people can quibble with the individual number, but I think the overall approach there is a reasonable one.
Dr. Tom Farley says more important than any one metric is the ability to detect and trace new cases. That means more testing and contact tracing. Do you think the metric needs to change as testing increases?
As I think I said before, if we were to have a huge increase in testing, twofold, threefold, fourfold, then it may be fair to reconsider that metric. I don't think that's happening right now. And we are seeing increases in testing. We're pleased with that, but it's not at that kind of scale.
And ultimately, Dr. Farley says he would like to see Philadelphia be testing at least 5,000 people a day. That is more than double what currently the city is seeing in terms of testing. Of course, the more people that are tested, the health commissioner believes they will then discover that there are more new cases. And with more new cases, that essentially delays how long you could expect the reopening to take. That's the latest in Philadelphia. I'm Mitch Blacher, NBC10 News.
Yeah, Mitch, did Dr. Farley say what he believes would be a realistic goal for new cases daily in Philadelphia?
Yeah, we did ask that question, and he didn't give a specific number. He didn't give anything specific in terms of a number of new cases that he thought was realistic, or how long a time span those new cases should necessarily stay under that number. He did say an important thing, again, is to monitor the new cases as well as to trace them, so you have the testing as well as the contact tracing that's so important. And he also says we are on the virus's timeline, not our own timeline, which led us to a conversation about the economic impact and what the impact of actually having a vaccine would look like. And those questions, they all come into play as we continue this conversation with Dr. Farley at 5 o'clock, Aaron.
All right, Mitch Blacher reporting live. We'll see you next hour. Thank you, Mitch.